Today's topic of discussion is morphology of reversible cell injury. There are four important characteristic features of reversible cell injury. First one, hydropic change. Second one is hyaline change. Third one is mucoid change. Fourth one is fatty change. So these are the important four characteristic feature of reversible cell injury: hydropic, hyaline, mucoid and fatty changes. First we will discuss about hydropic change. What is hydropic change? Accumulation of water within the cytoplasm of the cell. So this waters will accumulated in the cytoplasm of the cell. It causes hydropic swelling. So accumulation of water within the cytoplasm of the cell. The other name of hydropic change, cloudy swelling or vascular degeneration. Vascular degeneration. What is meaning of vascular degeneration? A small cavity which consists of fluid. Vascular, it is a small cavity which consists of fluid. So other name of hydropic change, cloudy swelling or vascular degeneration, mainly due to cytoplasmic vacuolation. Then what are the etiology of hydropic swelling? Hydropic change is the most commonest and earliest one sign of reversible cell injury. It is mainly caused by various etiological agents like bacterial toxin, poisons, chemical poisons, high fever, intravenous administration of glucose and saline. So mainly caused by these hydropic changes, mainly caused by bacterial toxin, poisons, chemical burn, high fever, intravenous administration of glucose and saline. Next, what about pathogenesis? Invalid regulation of sodium potassium pump result in intracellular accumulation of sodium and efflux of potassium that leads to the rapid flow of water into the cell, hence cellular swelling occur. So here invalid regulation of sodium potassium pump. So here what will happen? As a result, that intracellular accumulation of sodium, then it will elevate that potassium that leads to a rapid flow of water come into the cells. So it causes cellular swelling. What about crass appearance? See, these are the pictures. Affected organ like kidney, pancreas, liver and heart. All are enlarged due to cellular swelling. So first one is hydropic changes. So water molecules will come inside, it causes cellular swelling. It have another name, cloudy swelling or vascular degeneration. It is caused by various etiological agent. Here sodium molecule will come inside, potassium molecule will move to outside. So that's why here water molecule will come inside, so it will cause a cellular swelling. These are the enlarged organs examples. Second changes, hyaline change. Hyaline is a proteinous material. It look like glassy. It is a proteinous material, look like glassy. This one, hyaline change occur in heterogeneous pathological condition only. It mainly happen because of pathological condition. The change takes place maybe intracellular or extracellular. The changes takes place, it may be intracellular or extracellular. Intracellular seen in epithelial cells, example hyaline triplets. These hyaline triplets seen in proximal tubular epithelial cells. These proximal tubular epithelial cells presented in nephron due to excessive reabsorption of plasma protein in proteinuria. So intracellular, here it takes place in hyaline change takes place in whether intracellular or extracellular. Intracellular seen in epithelial cell, example hyaline triplet. This hyaline triplet seen in proximal tubular epithelial cell. This proximal tubular epithelial cell presented in nephron due to excessive reabsorptions of plasma protein in proteinuria. This extracellular hyaline is seen in connective tissue. Example hyaline arteriosclerosis in renal vessels during hypertension. So extracellular hyaline seen in connective tissue. Example hyaline arteriosclerosis in renal vessels during hypertension. Then hyalinized glomeruli in chronic glomerulonephritis. Hyalinized glomeruli in chronic glomerulonephritis. Due to any infection in kidney, hyaline accumulate in nephron. Intracellular hyaline, other few examples of intracellular hyaline, Mallory bodies. These Mallory bodies are aggregates of intermediate filamentous in the hepatocytes, which are predominantly seen in alcoholic liver cell injury or alcoholic hepatocyte cell injury. Intracellular hyaline, another example, Mallory bodies. This one aggregated of intermediate filamentous in the hepatocytes, which are seen in alcoholic liver cell injury. Then one more thing, hyaline inclusions. What about hyaline inclusions? Or hyaline inclusion bodies are seen in few viral infection. The viral infection example that Russell bodies represent excessive immunoglobulin in rough endoplasmic reticulum of the plasma cell. Russell bodies represent excessive immunoglobulin in rough endoplasmic reticulum of plasma cells. All these about intracellular hyaline. After hyaline change, the third event, mucoid change. Mucus is a secretory product of that secretory gland. Secretory product of secretory gland. It is a combination of protein complex with mucopolysaccharide. So it consists of protein with mucopolysaccharide. Mucin in the glycoprotein is the major component. Mucin, that is glycoprotein, is the major component. Again, that mucin can be secreted by epithelial cells of mucous membrane as well as connective tissue. The epithelial mucin change or you can say the epithelial mucin, you can see the disease of cystic fibrosis of pancreas. Cystic fibrosis of pancreas. This one is the diseased condition. Epithelial mucin change or disease. Epithelial mucin you can see in the disease of cystic fibrosis of pancreas. What is pancreas? Pancreas is the mixed gland. That means it will secrete endo as well as exocrine gland. It is also known as islet of Langerhans. It consists of three types of cell: alpha cell, beta cell and delta cell. Alpha cell will secrete glucagon. Beta cell will secrete insulin. Delta cell will secrete somatostatin. So in the pancreas is the small tube like one here which will transport all the hormone to the particular cell. Suppose that mucus will accumulate. Here mucus will accumulate in the pancreas, means what will happen? It affected all the hormones, so it causes cystic fibrosis. So pancreas is the small tube. What is the main role? Transport all hormone to that particular cell. Suppose here all the mucin will accumulate in this tube, means what will happen? It will affected all the hormones, so it causes cystic fibrosis. What about the involvement of epithelial tissue under mucoid change? Cystic fibrosis of pancreas and mucin secreting tumor. So it causes cystic fibrosis of pancreas and mucin secreting tumor it will cause. Next one is fatty change. It also called as steatosis. What is fatty changes? Accumulation of neutral fat in the parenchymal cell is known as fatty change. Accumulation of neutral fat in the parenchymal cell. So fat will accumulate. Liver is more than heart, skeletal muscles, kidney, etc. There neutral fat will accumulate. Then what are the mechanism? Increase in the peripheral mobilization of free fatty acid. So increase in peripheral mobilization of free fatty acid and uptake into the cell. Example, diabetes mellitus, it causes fatty change. Second condition, increased conversion of fatty acid into triglyceride due to alcoholic condition. Second condition, due to alcoholic condition, increased conversion of fatty acid into triglyceride. These are the reason it causes fatty change. Then third important condition, reduced oxidation of triglyceride into acetyl coenzyme A during hypoxia. That means decreased oxygen level leads to accumulation of fat. So reduced oxidation of triglyceride because of hypoxia, low oxygen content. Last condition, deficiency of lipid acceptor proteins, that is called apoproteins. Apoprotein carry triglyceride to the tissue or cell. Apoprotein absent means not carry triglyceride to specific tissue. So this condition seen in genetic tissue and protein malnutrition. Fourth condition, last condition, deficiency of lipid acceptor protein, that name is called as apoprotein. What is the role of apoprotein? Carry triglyceride to the tissue. Apoprotein absent means it cannot carry the triglyceride. So this one when will happen means because of genetic tissue and protein malnutrition. So this is what about that morphological feature what you can see in reversible cell injury. Thanks for watching.